anyways, the reason I'm doing this is because I had an unfortunate personal experience of being rather severely mercury poisoned by my dental fillings. And I'm kind of a lifeguard by, I don't know, personality. That was one of my first jobs, and probably the job I should have kept, because I've done it in other aspects of life without getting to sit by the water. So it was like, it happened to me. I want to know. It was very hard to diagnose, really hard to diagnose, because it's something that used to happen to people centuries ago, and we think it's a disease of the past. And so I've sort of delved into it, kind of full-time as a volunteer to sort of see what can be done about it, and been to all kinds of conferences like the International Academy of Oral Medicine and Toxicology in Minneapolis, the big giant health statistics conference in DC, a conference Saturday in Bridgeport, Connecticut, and, because the internet gives us access to all kinds of information that one couldn't get before, it's kind of interesting. And I always kind of combine looking at different things from both an economic and an ethical perspective is my training, and I've done it, as some of you know, with families and with older adults and, various things, but now I'm sort of doing it for the first time in the public health area. So what I've learned is it seems to affect people of a certain gene type, which is kind of new information. And there's so much new research coming out, late breaking. Just for example, in September, there's an article of the team that did the children's amalgam trials in Portugal in the mid-2000s, that originally found that there was no health impacts for young kids if they had it compared to other alternative materials. Well, the good thing is people make data available, so other scientists analyzed it and split it into boys versus girls, and threw out the outliers, and lo and behold, very different findings. So it was just the lead author of the original study just republished in September in the Journal of Neurotoxicology and Teratology, a study that finds there are health impacts in boys of a certain gene type, and on all 5 neurocognitive measures, they're, that sort of things that some people might say is like ADHD-like, were evident after 7 years in the amalgam boys of a certain gene type versus the non-amalgam boys. Girls, apparently something about the hormones protects them. My theory, which is not yet proven, is that as we age and our immune systems weaken and maybe our hormones weaken, that we start to get hit up with things like autoimmune, etc., if we're the wrong gene type. Then just October 2nd, Yale Medical School guy came out with a paper which hasn't yet been publicly released because he has to present it to the Yale School of Medicine's PR department, and they'll do the press release and other stuff will then come. But it found, in a nutshell, that dentists in Connecticut, compared to matched controls, had higher and significantly higher prescription utilization in 4 areas that he looked at: neurological, basically, various mental, behavioral, and cardiovascular and respiratory. So these are pretty significant findings. Unfortunately, when you get into the background on this, it's not pretty. The FDA has not acted on the recommendations of its own scientific advisory panel in 2010, which said it should be restricted in young children, in pregnant women, and in people with a known allergy to mercury. And that has not been acted on. And because of that, my dental plan and most people's dental plans won't pay for the cost, more than the cost of putting more amalgam back in the molars and bicuspids, because under their contracts with, in my case, Harvard University, my husband's employer, they'll only pay for alternatives to mercury amalgam in your smile area, which is your front 6 teeth, where very few people get cavities to begin with. And they also won't redo a tooth more than every 2 years. And there was also the FDA did come out with a ruling in 2009 as a result of a court case, and it's really too bad that public policy has to be driven by court cases, that recognizes that if there is amalgam, which is a mixture of 50% mercury and other metals together, is next to other metals like a gold crown or nickel or various things, or maybe what's in braces, it can cause the amalgam to degrade. And it's when it vaporizes, it can create damage again if you're the wrong gene type and don't clear it well. So I had work done on 2 molars 2 years ago, and now I'm faced with having to do it on my own dime because that dentist didn't know that there weren't supposed to be those mixed metals. So it's not only a problem of us not, as consumers not knowing, but unfortunately dentists don't know because they're told it's safe. The ADA maintains it's safe. They had a marketing campaign to call them silver fillings, even though they're 50% mercury and about a quarter silver. The ADA actually had patents on it, which have expired. It was founded as a pro-amalgam trade association. And there are 2 provisions in the ADA's Code of Ethics that dentists who promote removal of amalgam for health reasons can be expelled, and they have expelled dentists, so you can imagine dentists don't talk about it a whole lot. And doctors rely on dentists, so we have this kind of tough situation. It's been banned in Norway, Sweden, and Denmark in 2008 and 2009. It had been being phased out over a long period of time. The EEC is now looking at restricting it, or maybe more. It's a hot topic. There's international treaties trying, mercury's being phased out of other products. But it's actually, I've learned way too much about this. It's considered a medical prosthetic device in your mouth. It's not, like a drug or a substance or whatever. And so it's governed as a medical device. And for some bizarre reason, that means we don't need to get inserts, like every time you pick up a drug, it says what the possible side effects are and who to call if there's a problem. We don't get that for this. And so I didn't know it was 50% mercury. When one of my bicuspids was filled as recently as 2005, I got no information out. I would have said, I always paid for the white things when it was like, well, why not? But they don't always tell you. And not only when I finally figured it out, and I was very, very ill for 12 months, and I was filled 30 prescriptions last year. I had multi-systemic problems, and now I am on no prescriptions, and I lost not only a year of acute health problems, but 20 years of chronic disease. I had fibromyalgia for 20 years. And I also was treated for hidden Lyme. It kind of wrecks your immune system if you're sensitive to it. So, you don't get rid of things like that. But so I went from being about 30 years clinically older to about 30 years clinically younger. And I look around town and I see people who, aren't as healthy as we used to be. I'm a boomer, and I start to think maybe we could be healthier. And I've learned so much that I know for some people, again, not for everyone, this gene type is about 20% of the population. This is not good for us. And there are 4 states that have informed consent laws currently, and a handful of cities. And it seems to me such a no-brainer that we ought to know when they're putting something permanently in our, medical device, we ought to know what's in it, what the possible side effects are, and where to report. I tried, I'm trying to be quick here. So I'm trying to have informed consent in Sharon, and we take the lead on things like, no outdoor smoking in public places, and people try to lead good lifestyles, and I think there's very high health awareness, but this is a gap because I didn't know. When I go around the State House on this issue, people say, I thought we banned that years ago. And I said, we should have, but we didn't. And then they say, are they still using it? And unfortunately, the answer is yes. 50% of dentists don't use it anymore. I mean, it's not the best thing in the world, and some people figure that out. but 47% of dentists do. The challenge is it's not only a problem putting it in. So the other laws are informed consent about putting it in. As I've researched this more, the problem is also if it's taken out in an unsafe fashion, you can get problems that way. And that's, my problem started when I had a bunch of deferred dental work after I finished breastfeeding, and that's when I got my fibromyalgia, and now you can start to connect the dots. And in, the acute problems, well, among other things, apparently I was grinding my teeth at night, which maybe as you age, you start to do that. But it vaporizes, and it's been proven to vaporize in the presence of heat and abrasion. Now we're talking in the mouth. So hot food, hot liquids, showers, saunas, going over, being posted in Afghanistan, and abrasion. It's not just chewing or grinding your teeth. Think of people that have an accident, or a bump, or on a bumpy road, or ride horses, or fall, or, it's just not good. Rodeos. And so it's a major public health problem. Sharon could, I think, be proud of putting itself as the map of one of, a small number of communities, and I'm working with our legislative representatives to do something on the statewide level as well, and I'm working with people that are trying to get things to happen on the national level. This stuff was invented during the Civil War. We don't do much other medicine the way we did it in Civil War times. And it's, the science is clear. Science knows no borders. Unfortunately, as we know too well, politics is kind of sticky, and regulation. It's like, it doesn't keep up. It's even, the ADA and FDA recognizes that it vaporizes. What they say is that the levels are so low that below the occupational hazard levels. Well, occupational hazard levels are measured for 5 days, 8 hours a day. If you've got it 24/7, 365. And if you have the wrong gene type, you're apparently more sensitive and don't clear it. I've got tons of literature. If any of you are scientifically bent, oriented, I could bury you in studies and, stuff, what other states are doing. And now the good thing is, I guess, now these informed consent things, most of them were done before this FDA guidance document came out that has clear language, updated language. So they had to negotiate, basically, I'm told, 4 years between, public health department, dentist, the person who was promoting it to come up with language. Because we now have this FDA guidance document, I decided let's use what they negotiated in their
So let's talk about specifically the articles, the 3 articles you're proposing.
Right. So the first one I'll talk about is the informed consent for Mercury Dental Amalgam bylaw. So this says, the section 1, to see if we would add this bylaw,
That's Article 11, I believe.
First article is Article 10.
Yeah, she's talking about it's 13. It was 11. No, it's...
In the packet we have, Arnie, from October 1st, when we got a whole bunch of them. The first one is 10.
Yeah.
That's the one you're looking at.
That's the one
Right.
first
Oh, do you want me to go in your order? Or
Well, we've received multiple numberings, so,
why don't I go in your order then?
yeah.
Okay, good. Okay, this is the resolution. This is basically asking the town, or calling on the town, the Board of Selectmen, Board of Health, School Department, and any other relevant committees to consider how they might learn, publicize, and encourage residents to get involved on a voluntary basis in this project I've started called One Town, One Challenge, and it's SAFER, which stands for Safer Alternatives to Mercury, Amalgam, and Dentistry. Educational and engagement campaign to invite people, committees, and organizations to focus on the issues, risks, and safer alternatives to mercury, amalgam, and dentistry during the coming year. And then, I think, let me give you, I think you have one that, whatever, anyways.
So this is the draft we received from the attorney.
Okay.
Have you received those?
Yeah.
Okay.
And so I'll just have to, I'll later make sure that
It's
both working on
it's
the
just
same
asking this to make a resolution to the federal and the state government.
The second one, the first one is just to the town, and then the second is
To call upon the president, right.
Yeah, see, I shortened it. So now it's only the town and the president, and we cut the other ones out, to follow the recommendations of the scientific advisory panel to restrict its use.
Can we get a copy of that?
Yeah, I'm sorry, I thought I had emailed the latest, but I may have.
From the attorney?
No, I'm talking about a copy of the 2010.
Oh, yeah, I can get you that.
Okay.
Sure. You don't mind reading lots of pages?
Well, maybe the conclusion.
Okay, because I tell you, there's like a lot, So anyways, and then to follow the recommendation.
We are reading from a petition,
Yeah,
but we want to know what's being presented to the town. Not the petition, but the
The warrant article.
article and it will be turned into a motion.
right.
Right.
So I think you have the almost final version.
But it sounded like you took out sections 3, 4, and 5.
Right.
So that's all that you're really proposing are sections 1 and 2?
Yeah, I figured, we don't need to bury the town at this point, we could,
And has the revised article been sent to town council?
Yes.
They have it. Okay.
Yes.
Thanks.
Okay.
So, yeah, you can, well, I'd like to.
Did you change section 1 or 2 at all?
I think there is some slight change.
All right, but slight. So basically, that article said instruct the town, and it was unclear when the attorney was here saying whether we can instruct the town, whether that language.
Yeah, I
would
changed
actually-
it to call upon.
Right.
Yeah, call upon. So it's like.
It's an awareness.
It's an awareness
article.
campaign.
Yeah, it takes no force of law.
Exactly.
All
And
right.
we do already have this at the high school. The high school doesn't endorse things, but teachers are being invited to participate to the extent they're interested in putting it in, after school
Okay.
or committees or,
So that's fairly simple. And then the next one, regulation on the use of dental mercury amalgam.
Okay, and that's now called informed consent for mercury dental amalgam. Just because I tried to make it clearer, it's really driving at informed consent. So, and I actually spelled out, that one I said comparable in wording, so I said, well, since it's only 5 bullets, why don't I actually put the bullets in the warrant article, make it clearer? So the 5 warnings, contraindications and precautions that are required by the manufacturers that go to the dentist is warning, contains mercury, may be harmful if vapors are inhaled, do not use in persons with a known mercury allergy, do not place the device in direct contact with other types of metals, and use with adequate ventilation. So there would be, a sheet that you would get that would say those things, and then you'd sign off on it. Now, a dentist I met with today said that he believes as of August 2010, dentists are supposed to be getting informed consent for all procedures. I don't think they mostly know about that yet, so I'm going to try to verify that. But it could be that this is not any additional, procedure besides.
Yeah, I don't believe I've given any informed
Some
consent.
documents are, they're not supposed to do something, mind you, that you don't know that they're doing,
I don't believe I've signed anything in the dental office. Anyone?
They say,
No?
I
they're
know.
not supposed to
I'm
tell you
not
the truth.
gonna-
Okay.
Yeah, so this one would require a sign-off, as again, some other cities, like Philadelphia has it, and
And is that something we have the legal authority to do as a town?
I believe so.
Yeah, is this something, it seems to me this is something that would relate to the Board of Health. They enforce it, so have you been in front of them?
I was early in July when I was presenting the One Town, One Challenge, so, I just contacted them saying, when can I meet with you again? I actually think, I was sort of delighted that you called, because you guys are very responsible. And,
We have to make a recommendation.
Yeah. So I will be back there soon, and I have a lot more information about health impacts than I did back then, and about this informed consent and how it's been done in other places.
I gotta, how many,
The next meeting is...
at least with me, and I'm thinking maybe for the rest of this board,
I know, but
that we don't know
guess we
too much about this stuff. I never even heard of it being a problem or an issue. But what is it? When they put a filling in, they use mercury when they put a filling in somebody when they have a cavity?
If it's a silver filling, it's 50% mercury that's mixed with, it's mercury, 50% is mercury that's mixed with this amalgam of other metals. And so they call it dental amalgam.
And is this, like say, the people sitting around here, if we all were got fillings during our lifetime, what's the chance that we all have those kind of fillings in our mouth?
If it's silver
Probably 100%.
and was black, I would say 100%.
Oh, yeah.
If you're middle-aged and older, that's what you got, or
And how
what you
much?
had.
And how is there any statistics on the prevalence of? You're saying 20% of people have this genetic issue.
You're
Does that mean that 20% of the people have health problems because of having these fillings?
that's. I mean, the point of the educational awareness is let's get kids, let's get parents, let's get
that wasn't
professionals
I
trying
asked,
to research that. We can't definitively say. I don't even know the incidence of when I moved into town, it's like, and I got fibromyalgia. Everybody knows getting fibromyalgia. I don't know if it's an age thing. I don't know if it's a town thing. I don't know now if it's partially a dental thing and a Lyme thing. Some theories are, one of the biologic dentists I see says, if your immune system's weakened by, mercury, and then you don't fight off Lyme, it might be a post-Lyme thing. So we don't all know this, but we got a lot of creative, educated, motivated people in Sharon. So I'm saying, let's look at this. Let's get, do what we can to study the heck out of it. Research it. Maybe we can get much of us, healthier again. I mean, some people say, "Oh, it was just a miracle. You're so lucky." And I'm like,
well, you're not asking us to study it. You're asking us to be informed about it, right? And is this regulating use in this article? So if I'm a dentist, I would not be able. No, so I can still use it, but I need to inform.
This also talks
Someone,
about a
all right.
2009 guidance document from the.
Yes.
Can you also supply that?
Yeah, and that one is short. It's.
Well, I don't want it tonight.
Oh yeah, sure. Definitely.
What we do is we email to the Google group, and it gets
Perfect.
distributed to all of us.
And somebody will be assigned these articles
I don't see that.
to study it in total. No, I already volunteered for the other one.
Okay.
Was that reference, Gordon?
I can't
To
tell
2009. Where's
Right.
that?
It's under Article 11. It's the second from the bottom paragraph.
1B?
Yeah.
Okay, I see it.
And
I think you're right, though, Ira. The title of it probably should be changed because it says regulation of use, and this really, I think the title is.
yeah, so
Or
is
that
this,
it was
I
changing.
changed it
Oh, you
to
did.
informed
I
consent
get
for
you. Okay,
mercury
you already
dental
did, all right.
amalgam bylaw, because
Okay.
it wasn't. Excuse me.
How many
And-
dentists in town? Do you know what? I mean, there's a limited number of dentists. Are any of them using this mercury?
I know. At least one is. I'm not sure how many. I just, I'm sort of still in the research phase. The phone book.
Do you know how many dentists there are in Sharon?
Well, in terms of dental practices in Sharon, we're not
Practices.
talking about people who live in Sharon but do their
Correct.
dentistry elsewhere. The phone book had like 8. Now I probably need to see if there are some on Google or whatever. Because there could be ones that didn't show up in the phone book. So it's not a lot.
Okay.
Now, there's, just so you know, there is a lot of strict regulation by, I believe it's EPA on, their waste has to be separated so the mercury doesn't go into the water supply. And I don't know how they enforce that or check on that, but there's very strict regulations on mercury until it goes into.
Do you have any
the
penalties
after.
for non-compliance?
I did not do that. Didn't think about that. One step at a time.
But you're saying the Board of Health shall enforce the provision?
Yeah, I
Have you
think
talked
they
to them? You haven't talked to them about it. Have you
Not
sent them
specific.
copies?
They got copies.
And they haven't responded?
Yeah, not yet. But I think they will. I just think, it's the meeting whenever the meeting's scheduled. So I left a message today,
We'll put that on the list of invitees, not for Monday, for the following meeting. I think we'll probably full up for next meeting.
And now the one thing I did that is kind of a new twist is in thinking and learning that the problem is not just putting it in, but when it's drilled out, if it's not done under, the safest precautions, that people are at further risk. So I said, well, let's have informed consent for when it comes out, too, because there are protocols about how to remove it more safely and having, adequate ventilation and, things that, it's sort of like dentists aren't told this is a problem, so unless they think it is, they don't look to
Well,
do
you're
more.
informing people of a problem. What are you recommending people who have these fillings currently do?
Well, I'm recommending...
Not that you're giving medical
No,
advice,
I'm not.
of course, but...
I'm recommending that they look at the questions for your dentist that this International Academy of Oral Medicine and Toxicology has posted, and I can get you a copy of that. It's very short. It's just like, these are the questions to ask in terms of, we think it's good to have, these kinds of equipment and protocols in place.
No, but I say you've looked into this quite a bit. So what is a recommendation you've come upon if someone has a mouthful of silver or...
Well, listen,
Right.
that's not part of any of her bylaws, though.
Yeah,
You're asking
I-
just for
you know,
her
you
really
personal
can't-
advice on
I
it.
think if we're going to
Sure, my
educate
recommendation-
the
Yeah.
people of Sharon, we want to give
Well, my
them full information.
recommendation would be to find what's called a biologic dentist who pays attention to this issue, has been following it, and is better informed.
So we should Google biologic dentists
Yes.
and see what we come up with.
Right. And then, hopefully, dentists in Sharon, if they're not already, look into it.
All right, and there's one more article,
Yes, one
correct?
more
Yeah.
article. And that is the insurance one. Yeah, I've retitled that Cost Neutrality in Dental Insurance, because I've actually been sort of working this angle with other employers. Any employer, whether it's a for-profit business or a non-profit or a college or a town or a hospital or a law firm or the State House, I say, why don't you get your benefits administrator, when you rebid your dental plans, ask for quotes on a cost-neutral dental plan. And cost-neutral is one that would say, we would pay the same percentage for, amalgam or the alternate material. Because right now, again, if it's not, if it's in your bicuspids or molars, they'll only pay the percentage of the amalgam, even if, and you can elect to put in the safer alternative, but if you have to redo a lot of your mouth, as some people like me have to do, it becomes cost prohibitive, and we've paid premiums for
And,
decades.
Part of your article is to have the town track the...
I cut that. I decided that
Okay, so
we don't.
that's out, yeah.
That's-
That
now-
wouldn't be cost...
It would be
neutral,
very
right.
interesting.
it would be interesting.
It would make it. Maybe we could get a big grant to study the cost-benefit impacts of having cost-neutral dentistry.
So we need to see the revised language
Articles,
articles,
yeah.
yeah. So.
And again, they're
Reference
short and
these
simple.
articles specifically, Marlene, please, with the request to Lisa Whalen.
And they're
Because we
just-
know there have been changes.
Right, because it was like, the ones we first got, it's like you test drive it. And when it takes too long to explain it, and there are 3 of them because it's a resolution, it's like, it
Right.
takes too long. So let's simplify it, get to the core essence. I took out the stuff dealing with the state, because frankly, we can work with the state on our own. They're in the state. So, I took that out of the resolution. I took out the tracking because people said, tracking is time is money. That raises another issue. And maybe we, again, if we could get grants to do some of that stuff, that's fine. Or maybe, I'm working, I've worked on a lot of different issues. I raise money, I do stuff, so this is my thing.
I just want to alert you, I know you had
Yeah.
another appointment. I
Yes.
didn't want to keep you
Thank you.
from that, but appreciate your coming before us. and
Okay. Do you want
explaining these.
anything now, or would you rather? What I would
Is
do.
there anyone in the committee who'd like to see some of the literature?
Here's
No,
this-
she can just email it to the Google
Okay.
group.
Is it an electronic form?
Yeah. This
All right,
is
so
just
why
like
don't you
one.
send that and we can all
And
browse it
I'm
out.
also welcoming interns and volunteers if you have kids of any age.
Okay.
Basically middle school on up. Or people with time on their hands of any age. So.
All right.
Thank you.
Any questions for Laura? If we have any after we see the new ones, we'll certainly be back in touch.
Thank you.
All right. Thanks for your advocacy.
Great.